Hi there, so in this video I'm going to talk us and walk us through Hallgrove GP surgery to explain and show what changes have happened since the lockdown started. So one of the things we were required to do was to separate anyone that might have any type of infection from the rest of the population to try and prevent spread of illness to other patients and to staff. So one of the advice we had was if you have more than one site, you make one a hot site and one a cold site, so no infections going to the cold site. So we've made that the Parkway surgery. All our nurses are based there because our nurse team are seeing a lot more patients in person than the doctors. So Parkway is the cold site for nurses, and there are doctors stationed there doing phone calls as well and seeing patients as well if they don't have an infection and need to be seen. Then we've got Hallgrove, which is our hot site, and in there we've got room 3 as our hot room. So that's the only room where we'll be seeing patients with, I'd say, spreadable infections. Doesn't count things like skin infections or urine infections, but we're talking more chest, abdominal, obviously sinus, throat type infections. So if you think you have an infection and you put a request in for a phone call, either via the consult or you phone us up, we'll have a doctor will call you back and discuss it over the phone. They might ask you to take a photo and text it to us via our text system, for example, of a skin rash or your tonsils, for example. We might do a video consultation. And if it's felt that you definitely need to be seen in person, we'll put you through to the hot room doctor. So we have one doctor each day who is the only doctor seeing patients in the hot room, and this is to reduce spread of infection, so that that doctor won't be seeing an infection patient potentially with coronavirus and then seeing someone who definitely hasn't. So we have a hot room doctor and a hot room patient. The hot room doctor will call the patient up to clarify any of the history, to make sure they're clear on the symptoms, and then we'll invite the patient down at the set time. So that will be, let's say they say come on down at 2 o'clock. They will give the specific instructions, but usually what it will mean would be to be in the car park by 2 o'clock with your mobile, and then the doctor will call you up when they're ready in room 3 at Hallgrove, and will call you through the fire exit out the back of Hallgrove. There may be other instructions, but that's the most common. So if I talk you through it, I'm in room 5 at the moment, so let's come on out into the waiting room, and we come on through here. Or just something while we're here, if we look at this wall here, this used to be a toilet, and around here used to be a small cupboard, and we've now created a new consulting room there, so that's good. We need an extra person. This is room 3. So if we look at room 3, we've got rid of the manky old carpet, got some better clinical flooring. We've painted antibacterial paint over here, cleared it out of anything that could get contaminated. And this is our room that we would be doing all our examinations from. And usually what the hot room doctor would then do would be, after the examination, the patient would go back to the car again, or out to the car park, and then the doctor would go back to their usual room and would call the patient back to describe the symptoms. It might not always do that, but if it's raining, you don't have a car, you probably wouldn't do that, but most circumstances you'd go back outside and the doctor would send a prescription direct to the pharmacy electronically. So this is the fire escape door here. So the doctor would open up this door and call the patient from the waiting room. We've got some signs around. See that sign there saying hot room this way, and of course nice sunny today. There we are, there's another sign there, hot room this way. Plenty of signs, hot room this way, hot room this way. So that's how you access hot room. Coming around the front, out the front of Hallgrove, we've got lots of signs saying one person at a time. Do not enter unless you have an appointment. So we're looking for phone calls rather than people just turning up. And so we're coming on in, and we've got a doorbell here to ring. So I'm going to ring that, and a member of reception staff will come and let us in, just one person at a time. I'm going to go in anyway. And we've got these yellow things here on the floor, try and keep people away from reception so they're not too close, always within 2 metres. And then we've got back through to the waiting room, and we've got arrows on the floor here, so we've got a one-way system so that patients aren't having to come in and out through the same reception area past each other. So a one-way system, and then out through here, there's the arrows. We let Dr. Parry loose with a load of orange tape. He went crazy with them. So that's our one-way system. Something else that's just happened to have occurred is we've opened up another couple of rooms as well. This is a room, used to be room 1, that used to go that way, and we put a wall across. We've knocked into an old bit of cupboard space that was here to make a new room, and then we've created another room here. Then this was the rest of the original room 1. So we've got 2 extra new rooms now as well to be able to see more people. Okay, thanks, bye.